you very much, Ms. President. You are welcome to this okay, I couldn't see before then. My presentation is exactly in the afternoon, but thank you very much for this opportunities to me. One speaker didn't come, and I can find present to my presentation to you. I would like to say about my titles in this presentation: Innovation in Nurse Training in the Integration of Simulation into Postgraduate Education. It is not so much from here, Turkey and Spain. I introduced yesterday about Turkey, so I can start my presentation today early. When we thought about innovation, what is the innovation? Is the process of developing new approach, technologies, and ways of working. And innovation starts with a good idea, but it is much more than that. And first of all, you have to dream, and after that, you can discover, and the end one to deliver. Why is innovation in nursing? Because of complexities in nursing and healthcare delivery, national focus on patient safety. There has been a call across nursing organizations and healthcare organizations for more innovation in nursing and healthcare education. We have to press on the different characteristics in all of the world: clinical autonomy, culture, structure, recognition, collaboration, peer review, and patient outcomes is affect the health system in all the country. Innovations such as a balance between the professionalism and clinical autonomy, and it's deliver the quality patient's outcome if we can success this balance in the health work environment. So my challenge to you: continue learning and growing and doing the very best you can in your individual nursing practice as you care for your patients. Simulation is innovation, is very important issue. First of all, when we start, we would like to establish simulation center in our university, but we couldn't have any budget for this one, because our university was the government university, couldn't support in this subject to us. So we decided writing European Union project, and it says except after that we can start the building our simulation laboratory. It was very hard time for us because every faculty member was very angry to us, because everywhere built and crowded, everyone was there. We were working together with electrical technician, architects, or other person during this process. And at the end of this busy time, we established our simulation center at Hacettepe University Faculty of Nursing, and we complete the technical equipment and placing of material in there. You are seeing now some implementation during our scenarios, the students working there, and we are watching them in the observation rooms. If they do any fault or wrong injection, your wrong implementation, we can change the all patient results on the monitor. We construction the simulation laboratory such as an emergency unit, one acute care bed with a patient simulator, a nursing station, oxygen system, AV system, cabins, and a variety of medical emergency equipment in this area. The control room very important area also, because you are organize all kind of scenario in there. Our students couldn't see it to us, but we can see them all their implementation during this scenario implementation and documents related to scenario to students. And after our observation and recording their implementation of scenarios, we are giving the debriefing session together. Our debriefing room is include a data projector, computer, table, chair, desk with 10 or 15 students. Our scenario script is here. I mentioned it yesterday also. You are seeing some debriefing session during our after scenario implementation, and we are doing every year. Especially, I give a lecture about nursing management and leadership courses and obstetric and gynecologic nursing courses in our faculty. So we are integrate this kind of simulation implementation to our educational system in the undergraduate and graduate level. We are also talking about all kind of activities in Turkey, international or national level. In our country, in a small number of schools have integrated simulation into education in undergraduate level, and they have limited facilities. However, the relevant literature on simulation in postgraduate education in nursing is not accessible. It is important that health professionals improve their knowledge and skills in all areas. However, it is a primary issue in our country for students to increase their knowledge and skills in maternal and child health, which are indicators of national development level. Thus, an elective courses entitled Teaching Simulation in Maternal Child Health Nursing was opened in Hacettepe University Faculty of Nursing, Departments of Obstetric and Gynecology in Master and Doctoral program. Our program objective was to gain knowledge, skills, and analytic abilities for use in the instruction of maternal and child health nursing and the assessment of skills. The practical foundation of this course is the high-fidelity simulation laboratory and hybrid simulation laboratory that were established by the European Union project. I mentioned it before then also. Also, we are giving some media presentation how we can do this kind of implementation. Innovation should be accepted to be necessary for the creation all policies and strategies. If any kind of innovation is to be made, institutions should promote innovative and creative practice, provide appreciate environments, and act as role model and as a leader. We need to have same vision for innovation, how they can manage this kind of implementation, how they can increase their competencies level. last 2 days, we are talking about what nurses do in the different kind of disease, different kind of activities, and academic nurses, what will do their educational level in the nursing. So, first of all, I have some recommendation to you because very important, especially first of all, must be nurses be well. So my recommendation, especially it is very parallel with innovation. First of all, you have take time for yourself. Go have fun in the meadows, because first of all, must be a nurse is a good feeling, good emotional, or good physical conditional. So we need to do some a positive aspect to yourself. So avoid, everyone know about it, but avoid bad habits is very important. Another issue. Always listen to good advice is also important. Always be alert, then wait, perhaps you are looking for will find you. So we have to go our objectives every time. We will catch them as soon. We don't withdraw in this subject. Always be ready for any surprise in life, because health system is very complex and all of the world is very complex. We have to be ready for this kind of surprise. Always look at where you are going, what is your objectives, what is your aim in the professional and other levels. Be determined in achieving your goals is also important issue. You have to do some strategic planning in all kind of subject. And the life is very stressful. Don't let the situation confuse you. You can find solution of your problems in every condition. And always take yourself is other important issue. Thank you very much for your attention. And in this presentation again, I would like to invite all of you to Turkey. Turkey is a very good country. And you can see Istanbul, Izmir, Ankara, Cappadocia is very special area in Turkey. Thank you very much. If you have any question, I would be pleased to answer them.
Thank you very much to my hardworking and successful friend from Turkey.
Thank you.
This good introduction. Any question? No, perfect.
Thank you.
No question.